Under normal conditions, human biology operates on a remarkably strict countdown. If a person's heart stops beating, oxygen-starved brain cells will begin to sustain irreversible damage in just 4 to 6 minutes. But those biological rules begin to warp in extreme environments. In late May of 1999, a 29-year-old medical student named Anna Bågenholm was skiing with 2 friends in the mountains of northern Norway, high above the Arctic Circle. As she slid down a steep section of the slope, she lost control. She plummeted headfirst through the surface of a partially frozen stream, instantly wedging her upper body tightly beneath a thick layer of ice. She was completely immobilized in water, hovering at barely 2 degrees Celsius. In an instant, a simple skiing fall had become a grueling stress test against the hard limits of human physiology. She managed to avoid drowning in those first few minutes because she found a tiny pocket of air trapped between the ice and the stream bed, just enough space to draw short, panicked breaths, while her friends desperately tried to pry her out. As severe hypothermia takes hold, a body initially reacts with agonizing physical distress. However, as her core temperature continued to plunge and her neurological functions started to fail, that panic gave way to a strange, paradoxically peaceful calm. This graphic shows exactly what the cold was doing to her internal organs. Over the course of 40 minutes, her core temperature sank from a healthy 37 degrees Celsius all the way down to a staggering 13.7 degrees. At that exact temperature, her heart gave out entirely. She had no pulse, and she had no detectable brain activity. She was clinically dead, and she would remain in this suspended state for over 3 hours. By the time a mountain rescue team finally freed her from the ice, another 40 minutes had passed. During the long helicopter flight back to the city, the medical crew relentlessly pumped her chest, manually breathing for her the entire way. When she landed at the University Hospital of Northern Norway, she had been without a heartbeat for 80 minutes. Standard emergency protocol dictates that resuscitation efforts should end after roughly 30 minutes of no response. The senior physician on duty, Dr. Mads Gilbert, looked at a patient with a body temperature nearly 24 degrees below normal. Instead of calling the time of death, he decided to test a theoretical concept in emergency medicine. There is a highly specific phrase that guides cold water rescues. No one is dead until they are warm and dead. You cannot reliably call a time of death on a severely hypothermic patient until their core temperature has been restored to normal, and their heart still fails to respond. Based entirely on that medical philosophy, Dr. Gilbert bypassed the standard cutoff protocol and committed his team to a high-stakes, highly complex resuscitation attempt. They were relying on a biological paradox. The same near-freezing water that had stopped Anna's heart was simultaneously acting as a shield for her brain. Here we see how a cell's metabolic rate responds to extreme cold. As the temperature plummets, cellular activity slows to a tiny fraction of its normal rate, drastically reducing the amount of oxygen the cells need to survive without normal blood flow. To exploit that protective shield, the team connected Anna to a heart-lung bypass machine known as an ECMO circuit. This device continuously extracted her blood, oxygenated it, warmed it degree by careful degree, and pumped it back into her body. Taking a look at this timeline charting her rewarming process, progress is agonizingly slow. Even warmed to 25 degrees, cold suppressed her heart's electrical conduction, leaving monitors completely flat. Then, reaching 30 degrees Celsius, 3 hours and 22 minutes into clinical death, the flat line abruptly spikes. An irregular signal appears as her heart spontaneously starts beating. Achieving a pulse after nearly 3.5 hours validated the team's extreme approach to rewarming her blood, but fixing her heart immediately raised a much more troubling problem regarding her mind. Even with her circulation restored, her brain had survived on an absolute minimum of oxygen for an incredibly long time. The medical team had to wonder if the cold had actually been enough to prevent catastrophic, irreversible brain damage. For days, there was no clear answer. Anna remained completely unconscious, reliant on mechanical ventilation, while neurologists watched closely for the absolute slightest response to physical stimulation. Slowly, the signs appeared. She eventually woke up fully cognitively intact. The prolonged freeze did cause severe nerve damage in her hands, requiring years of intensive physical rehabilitation to regain her basic motor control. But her personality and intellect were completely untouched. She went on to finish her medical degree, and today she works as a practicing radiologist. Waking up with a functioning mind proved the extreme protective power of cold. It demonstrated that human cells could weather long stretches without oxygen, entirely bypassing the conventional countdown to brain death. By the year 2000, a detailed report of her survival was published in the prestigious medical journal The Lancet, allowing the global clinical community to study the exact circumstances of her treatment. The data from that night established a stark new lower bound for survivable human body temperature. Physicians suddenly had a verified human case study, giving them the clinical justification to keep going when treating extreme hypothermic cardiac arrest. The case also provided crucial momentum for using ECMO bypass machines in emergency settings, accelerating global research into deliberately cooling patients to protect their brains after normal cardiac arrest. Anna Bågenholm spent 202 minutes without a heartbeat. She is alive today because one emergency room doctor understood that the boundary between life and death is not always strictly governed by a clock, but by temperature.